Services, Murrumbidgee Local Health District.
Correct. Good to go.
Yeah, just to make sure. It's like a head injury assessment at rugby, you know. It's, all right. Yeah, it's been a good weekend. Good morning, everyone, and welcome to the weekly update about the status of COVID-19 in the Murrumbidgee Local Health District. Once again, good news, no new cases of COVID-19 in our health district, and that means that our streak of case-free days is now up to 62. The community has done a great job, and we've done about 80,000 tests, which really is, you know, about 30% of our population, which is absolutely great. And then probably the greatest bit of good news is the fact that our borders with Victoria will open on the 23rd of November. So we are very excited about that and pleased, and that there'll be an opportunity for, you know, people to connect with family, friends, which has been quite difficult, you know, during the last few months. I think it is very important to remember that the reason why we have done so well is because of the way we acted. So it really is important, if you're in any way unwell, please isolate and get a test. If you're unwell or concerned, please do not visit vulnerable members of your family. And then, you know, continue to do all the right things. If you can maintain the social distancing, you know, hand washing. If it's impossible to maintain social distancing, wear a mask. It's been shown to be extremely effective. So that's, you know, really great news for everyone. The other bit that is important as we go out more, it is a requirement that businesses will have a COVID-safe plan. So if you turn up at a business and there's no COVID-safe plan, they really are placing you at risk. So, you know, I would then probably, you know, support someone who does have a COVID-safe plan. We're obviously very excited about the holiday period coming up. Sadly, for some people, it is a time of increased psychological distress. The good thing is there's a large number of organisations that you can access through the Health Direct website that can provide 24/7 support. Do not underestimate the impact that this year has had on people. You know, bushfires, COVID-19 pandemic, with all the associated problems. It's been a tough year for everyone. So please, you know, if you feel that you need help, please seek that help. It's very, very important. Any other questions for me at this time?
With that concern about psychological distress this time of year, are you expecting this year will be worse than any other year because of that added COVID pressure?
Well, we have noticed that there has been, you know, increase in psychological distress for people after the bushfires, and that has only been worsened by the COVID-19 pandemic. You know, we normally are social creatures, and our ability to socialise and interact with other people has been severely limited. And once again, especially truly vulnerable members of the community, you know, residents of aged care facilities have not been able to see their families as freely as they normally would have, and that has got an impact on the residents, but also their family. You know, kids love their grandparents and love their parents, so it really is something that we have to consider. And I can assure you that whenever we consider a measure, it is not just the infection risk or the public health concern. We definitely take into consideration the more you know, sort of non-direct effects of our measures. So it really is important that we keep that in mind.
Are they likely to change then before Christmas, given that they have been quite strict, and order to get people into aged care centres around Christmas?
We'd have to be guided by New South Wales Health, and you know, it's very difficult to comment. The one thing I can say is that there has been attempts to get restrictions in line with what we perceive as the risk. So, you know, something may happen, but we would have to wait for the New South Wales Health and the Public Health Unit in New South Wales.
Just how are local health authorities, I guess, going to cope or manage when the border opens? I guess there's been some sort of element of control with that heart closure recently as well.
Well, you're absolutely correct. I think the great news is Victoria is now 10 days without any cases, which is, been a magnificent piece of work by the Victorian government and, the community at large. I think the most important thing is to follow the sensible rules, because having the borders locked, just means that people can't get into New South Wales. But if you do the right thing and get tested if you have symptoms, the risk to people around you is actually very, very small. And if you follow the rules that we've had in place for a long time, the risk would be increased, but not in a way that we cannot manage it.
What are you doing as a health district to prepare for that opening? Because I imagine we'll have a lot of people coming into the region and say if they need a test, they might not be familiar with the area or where to get tests. Are you trying to do more education around that, or is there any other ways that you're preparing for the opening of the border?
So we're obviously looking at our testing capability, but the most important thing is that if people want a test, they can either contact the local hospital, who could then refer them onto the COVID hotline, or they can just ring our COVID hotline. And luckily, with social media and access to the internet, all the information's on there. So it would be great if you could share that with people, that the details of the COVID hotline. But if you're in any way unsure, you're more than welcome to contact your local hospital, and they can put you in contact with our COVID team.
No, you don't.
I was going to say, as a health district, obviously staffing's been a bit tricky with the border closure. You guys must be looking forward to having your freedom of movement back.
Yes, well, it was quite interesting. On the way here this morning, I quickly popped into the base hospital and I was speaking to the locum coordinator. So it will, be a great relief for us to have access to medical staff who normally resides in Victoria, because obviously because of our close proximity, they do provide quite a bit of locum support for us. So that's, great news for them and great news for us. But once again, we still need to make sure that we follow the good practices that have been in place.
And along the border, obviously a lot of sort of smaller hospitals and whatnot, and it'll be a very popular place over Christmas and New Year. Are you confident that, if any cases present there, they'll be able to handle that sort of demand?
Yes, well, they've proven that when we had the recent concern about the outbreak in Shepparton, it was very easy for us to ramp up our testing capability, and we did large numbers of tests very quickly. I think the most important thing is for people, if they're concerned, is to have a test, because that really is the only effective measure we have. I think it is obviously important that when you go and book your holiday, I would definitely make sure that the holiday park or the business does have a COVID safe plan in place. And then, make sure that you do the right thing and behave responsibly.
No, you go, it's okay.
I was just going to ask, how different is the situation now in terms of if there is an outbreak, being able to manage it? Because someone just asked me the other day was, do you think we'll get a third wave? And I said, I don't know. I presume we have more. It's easier to lock it down now and try and isolate it. Is that the situation? What sort of assurances can you give the community?
Well, the way that I see it is that there will probably continual ripples. It won't be a wave, but it's not unexpected that you will have localised outbreaks. I think the one thing that we've shown in New South Wales is that we've got a very effective contact tracing systems, and that really is the way to manage it. And we've worked hard for almost 12 months now on COVID. So our systems have been tested, refined, so I'm very confident that we can respond appropriately. And probably the most recent example is how well the Victorians responded. And 10 days without any cases, considering the situation they had before, is a tremendous achievement.
Just thinking along the border, has the MLHD got a plan to sort of coordinate with health authorities on the other side to manage any future outbreaks? Or say, I know, in Albury-Wodonga where people cross a lot to go to either hospital, how's that going to be coordinated now?
So we are in regular contact with Albury-Wodonga Health and Bendigo, Shepparton healthcare facilities that we share an operational relationship with. And we will just continue to work together with them, because they obviously provide valuable care to patients in our community. And I think we've done a very good job in terms of collaborating with our colleagues. So it really, for us, it would just be business as usual.
With those COVID safe plans that you were talking about and making sure local businesses are doing that, particularly if we're going to have an increase in visitors, how are local businesses going with that? Are most people doing the right thing? Do you still have some concerns?
Yes, the information that I have is that most people are doing the right thing, and there is obviously compliance checking that's conducted by the public health unit. So there will be, random inspections to make sure that businesses follow the rules. And the way that I look at it, that's in everybody's interest, because we don't want to be in a situation where there's a lockdown and businesses are closed down, but we have a responsibility to keep the community safe. So, I think COVID safe plans and, collecting your details when you go into a business is just going to be part of the new normal for the foreseeable future at least.
Businesses and sort of community gatherings, I suppose the silly season's coming up, so increased risk in mass transmission if something did come into the city.
Yeah, I think though that we still need to remember the rules. We say that if you've got an outdoor gathering, no more than 30 people, no more than 20 people at your house. I must say, I think if you're going to a gathering where you can't remain 1.5 metres away from other people, I'd strongly advise people to wear a mask. And once again, if you're unwell, please don't go. That's probably the most important thing. And that's really the beauty of the measures that we have in place, is that if you follow all those rules, the risk will be small.
Just before I came here, I saw in the news that they're starting the manufacturing of a vaccine today, and they won't roll it out until the Oxford trial's successful.
Yeah.
How exciting is that, or how significant is it to have that manufacturing underway?
Yeah, no, well, it's great news for us because until we have a vaccine, the only defence we have against COVID is really all the social distancing measures that we have in place, testing, isolation, wearing of personal protective equipment. So having a vaccine will change that, and especially being able to protect the most vulnerable of the community and frontline healthcare workers will be a tremendous advantage for us. And I can assure you that there's already planning in place about how we would conduct a mass vaccination, because it's going to be something of a scale that we've not seen before. So there is work underway to essentially plan how we will actually, get the vaccine to everybody who needs it as quickly as possible once it becomes available.
So that planning's already underway locally?
Well, it's on a statewide level and also locally.
How's Wagga Base Hospital going with the elective surgery resumption?
So we're doing about 100 extra cases per month, which for us is about, almost 10% more. And we have reduced the number of overdue patients. And we, once again, working hard to make sure that patients get their surgery as soon as possible. We obviously have to be cognizant of our staff as well, and everybody's looking forward to a well-earned Christmas break. But, managing the overdue patients will be a piece of work that will continue on into next year. And it really is just to make sure that we treat the most urgent patients first, and then make sure that we allow the patients who've been waiting the longest to get treated as well.
Can you tell us any more about what a rollout of a vaccine would look like locally here?
It's a bit difficult to provide you more details now. I'd probably wait until we have more information that I can provide you, more accurate information.
Thank you very much.